So, so today, so today is another Friday, and as you all know, it's our clinical seminar. It's our clinical seminar presentation day. So, hope the teams are ready. Are we all ready? I'm not hearing you guys. Are we all ready? Okay, so let's do this. So we have three teams, and so far you've been taken by different doctors: Dr. Raphael Omra, Dr. Amina Umi Garuba, and Dr. Bolanle Hawa Akombi, right? So hope you had an amazing time during the lectures, and hope the little practicals or the practicals you did were also good. All right. So let's start with the first team. The team starting is Team Resilience, right? So let's listen to Team Resilience. And still don't forget, as I said last week, so the clinical seminar is not a time to criticize or make you feel like you didn't do anything, right? It's just a time where we have a general period to have different ideas and views of what you've done so far. So let's keep that in mind so you know that it's not do or die affair. It's just a time to share ideas. So after the presentation by each group, everyone in the room is free to ask their questions and the group will answer. And during the presentation, take note that the doctors available here would be grading you based on the same criteria we used last week: your composure, your dressing, your PowerPoint presentation, and all. Is that fine? All right, so let's start. So, so yes, you have 15 minutes for each presentation. So 10 minutes for the presentation and then 5 minutes for the question and answers. So still remember that we are going to grade you based on your timing during the presentation. Hmm? All right, so let's have our good time. So group Resilience, let's have you on stage and listen to you.
Okay, okay. Good morning, senior colleagues. Okay. Okay, it's okay. Okay. Is it okay? We can start. Okay. Good morning. Okay. Good morning, everyone. Good morning, senior colleagues and my fellow intern. My name is Ape Ojoshigbe Uyo, and this is my team, Team Resilience. And this week we were on small animal rounds, and this is our content. Another slide. The next slide. And the next one. Okay. So my name is Ape Ojoshigbe.
And I'm Gabi Peace.
Aminu Mahmoud.
Lukman Abdullah.
And we are Team Resilience. Okay, this week, this is what we're going to talk about in our clinical conference. We're going to discuss clacking, essentials of clacking, importance of clacking, limitation of clacking, diagnosis, and how to prepare at diagnosis, type of diagnosis, error in diagnosis. So this is our content. And I will begin. Okay, clacking is a process of interacting with clients regarding the case. It involves taking full history, physical examination as well, past medical history and what again? And the documentation of the patient notes, including the documentation during working process. We also take differentials. What this means basically, in a layman term, is getting information from your client about its patients, because you know the animals don't talk, so it's the owners that will help you talk. You take simple history like past medical history, breed, name, and sex. Thank you.
So in clerking, there are essentials of clerking. These are the things that, as a doctor, you need to do while clerking. So you need to make your clients and patients comfortable. And then do your best to create a fear-free environment. Don't ask leading questions. Also, do not be judgmental over your client's claims. Ask questions that need specific answers, that is yes or no. Also, make sure your consultations are private. In that way, you can get your client to speak to you because he can confide in you about the patient. Use all your senses to listen, that is, use your eyes to see, your ears to hear, and your nose to perceive. Check that what you think is wrong with your patient is what is actually wrong with the patient, so that you can arrive at the correct diagnosis.
Okay, importance of clerking. Okay, I want this really fast. Importance of clerking, it helps to keep a proper record of the patient's data, so that for reference purposes in case of next time. It helps to arrive at a diagnosis. If you're able to get the right information from the client, it can help you arrive at a certain diagnosis. We'll expatiate on that later. It helps the clinician to understand the problem and how to manage it. I think this is self-explanatory, and it helps to keep your record organized. Thank you.
Now, the limitations of clerking. There are some problems that doctors normally face. The first one we'll talk about is the language barrier. That is when the client and the doctor speak different languages. And also, when your client is not willing to give the information you need for clerking. And then, when your client is not being truthful, that is also a problem. We also have unavailability of the clients, maybe when the patient was brought, probably after a hit-and-run case. And then when the clerking personnel is not a good listener. So that is all for clerking. This is an example of how to clerk. When you take the details of the client and of the patient, as it is clearly seen on the screen.
Good morning. I will talk. Okay. I will talk on diagnosis. The diagnosis is the act or process of identifying or determining the nature and cause of the disease or injury through evaluation of patient history, examination, and review of laboratory data or test result. Then, how to arrive at diagnosis? Accurate diagnosis requires data from the following sources: medical history, physical examination, tests such as blood tests, imaging tests, biopsies. Then types of diagnosis, we have differential diagnosis, tentative diagnosis, and confirmatory diagnosis. This differential diagnosis is more of like listing the possible causes of the disease, or what are the possible, as a clinician, what are the possible causes of a particular disease from when the animal came into a clinic. Then tentative diagnosis, it requires professional knowledge and clinical expertise to arrive at tentative diagnosis. For the differential diagnosis, it's very important so that to rule out certain possibilities that might cause the disease condition to arrive at tentative diagnosis. And with this tentative diagnosis, it requires knowledge, actually, to arrive at this tentative diagnosis. And usually this tentative diagnosis is, you are thinking of more, the most possible cause of the disease. That is tentative diagnosis. Then confirmatory diagnosis, some literature they can even tell you is a diagnostic test. So usually achieved in lab using laboratory equipment. That is how confirmatory diagnosis can be achieved. Errors in diagnosis. Usually there are some causes and factors that can trigger in having errors in diagnosis, like manifestation of disease condition that is sufficiently noticeable, a condition omitted for consideration, too much significance given to some aspect of diagnosis. The condition is a rare disease with symptom of other conditions. The condition has a rare presentation. These are the possible, but not all. Thank you.
Thank you. That's all we have. Thanks for listening. So.
Thank you for the presentation. You guys did well, and it shows that you learned something throughout the week. So everybody here is free to ask questions. So if you have questions, you can throw it at them and they would answer where we are grading to. Okay.
Hello, good morning all. My question goes as, there's one statement you made that you say, ask the question that is yes or no during clerking. I need more clarification about that. The second question is, during the differential diagnosis, as you say, as you say, okay. How do we get the tentative diagnosis? Where do we get it? From where? We can arrive at the tentative diagnosis.
For the first questions, she said that don't ask leading question. Try and ask questions that would involve yes and no answer. Those are direct questions. When you ask leading questions like, okay, the dog now started passing out feces, right? So you're already pushing the client to just say, okay, yes, this is what it is. So you ask questions like questions that can bring out answer for you to know what you don't ask. So it now started. You ask that when did it start having diarrhea? So the person will now tell you, okay, it's the one that told you that it started passing physics. So you will now tell him that when did it? So he answers you in a way that you would be able. You don't give the client reasons to lie. So that's just what you're trying to do.
Thank you for your questions. Okay, thank you for your questions. As I said, differential diagnosis is usually more of the listing of the certain conditions that you think is the cause of the disease. For you to arrive at tentative diagnosis, as I said, it requires scientific knowledge, clinical expertise. Are you getting me? So that there are some diseases. There are some diseases that they have pathognomonic signs. So with that, you can achieve, you can arrive at tentative diagnosis. So when, as a clinician, and you have these skills, then you can come to tentative diagnosis. As I said, differential, you are trying to differentiate it with what? Tentative diagnosis.
I didn't get your definition of differential diagnosis. You were talking about something that causes disease. Differential diagnosis is not. Okay, yeah. Please, can you re-explain differential diagnosis?
Thank you. Differential diagnosis involves you listing possible causes of the condition, because based on the symptoms it's showing. And then while tentative diagnosis would involve you using pathognomic signs and other experience.
Let her
don't believe that differential diagnosis is what causes a disease. It's the way you're putting it. Can you explain the...
Okay, differential diagnosis. When you want to treat a case, as a doctor, you have to calmly, you're supposed to be open to many options. So you list out all possible diseases that can have this type of sign and symptom. So with that, you can now start narrowing down to get your tentative, then clinical, this thing to get your definitive.
Thank you very much for your wonderful presentation. So when uh, the first speaker is talking, when she listed all what we need to acquire from the client, she didn't make mention of signature. Do we need this client to sign after getting all the information or not? That's my question.
Yes, we need signature. If you check the slide properly, there is a photograph of what proper clerking is supposed to look like. There, because of time, that's why I rushed my something. So see, as you can see, there's even an email number. See, just in case you cannot see it. See, it's client signature, phone number, email, address, and so on. Thank you.
Do you have any other question for them? Mubarak, you had a question. So we are cleared, right? Okay, so give them a round of applause. And well done. Well done, team. All right, you can have your seat. So the next team, right, it's the erudite team. So let's have the erudites give us their presentation.
Good morning. Okay, my name is Innocent Mary. This is Team Erudite. I would give members of my team to introduce themselves.
Okay, I'm Betif Benjamin.
Usman Hassana.
I'm Ojigo Precious Chidima.
I am Mubarak Aliun.
So, permit me to apologize. Just a little oversight. Good morning, doctors and my fellow interns. Today we'll be speaking basically on a case we had in the clinic. Within one of our days in the lab, a case was brought in the clinic, and a sample from the clinic was taken to the lab for analysis. And a patient was brought in actually, and it was noticed that this patient, a dog, was tick infested. So we took a sample of one of the ticks, just few samples, and we ran some analysis, and we discovered that this tick is a hard tick that goes by the name Amblyoma Americanum. That was what. Next slide, please. Yes, you can see a picture of the sample that we got, and this was when we were running that analysis to be able to differentiate by physical examination what we can see, and we were able to also classify this sample as a hard tick. In the course of this presentation, my colleague will distinguish what this tick is.
Okay, so discussing on ticks basically. I'll be talking about ticks. No, the next slide, not this one. Okay, basically I'll be talking about ticks here. So what are ticks basically? Ticks are just parasites, ectoparasites of animals that suck blood and cause infections. So we'll be talking about the types of ticks. There are hard ticks and there are soft ticks. Examples of hard ticks, we have the hyaloma, which causes, we have the hyaloma, we have the bufilus ticks, we have a range of ticks like amblyoma and rhipicephalus. They cause different diseases like the anaplasmosis, ehrlichiosis, and babesiosis, and the rest. So for the soft ticks, we have the agars, the ornithodoros, and the rest. So my colleague here will be giving you a step-by-step way of differentiating the hard ticks from the soft ticks.
Okay, for hard ticks, normally they are, okay, for hard ticks, normally if we differentiate the hard from the soft based on their morphology. For the hard ticks, they have a scutum. It's like a sheet at the dorsum. And the soft tick, they don't have any scutum. Then their life cycle also, the hard ticks, they have only one nymphal stage, while the soft ticks, they have like about 2, 3 or more nymphal stages, depending on the type of the tick. Then also their feeding time. For this hard tick, they feed only once, but they are always attached to the animal. While for the soft ticks, it feeds for like 30 to 60 minutes, then it drops, lays some egg, then it comes back, suck, and then fall off too from the host. Also, in terms of their egg laying time, the hard tick only lay egg once, while the soft tick lay eggs several times. Then also the number of egg also varies. The hard tick, they lay a large number of egg at once, like about 3,000 to 8,000 eggs, while the soft ticks, it lay eggs several times, but also in small portion, like about 300 to 500 eggs per time. Also, their mouth part, that is the capitulum, is anterior for the hard tick, while for the soft tick, it is that is the hard tick. You can see the mouth part visibly. Sorry, while the soft tick, it is invisible. You can't see it from the dorsum.
So I will talk on, since we so far so good, my friends, they talk on ticks so far. So now we have to go for how we can manage that ticks to our patients. As we are going, so we can, antihelminthics. They are prosthetic, so we have to go for the anthelmintics such as ivermectin injection. We have the suspension, the tablet, and the injection tablet. Then we go for the levamisole. So we have to be cautious enough for administering of levamisole injection, because it's so, as you give overdose, you are killing the animal. Over low dose is dangerous again. So you can forward the dipping. At the same time, you can go for the tick spray. And then I would like to speak on how we can prevent factors for predisposing to that tick, like the damp area and their environment. If it's not that well equipped, the animal will come down with that ticks. Thank you.
Okay, so I will be speaking on the thin blood smear. So one of these days, we took a sample from one of the horses, and this was the steps we took to be able to decipher like what is wrong with the cell or the blood. To prepare a blood smear, you get a drop of blood of the animal, horse, whatever. You put it on the slide. Like, normally we have the thin and the thick. The difference is just the concentration. Let me say the blood concentration you leave on the slide. So the thin blood smear, you don't leave much, so it's like faint. so you're able to see things easier. So a drop of blood was placed on the clean glass slide, and then a spreader slide was placed on the blood to make a smell. So you place it on the slide and then like you drag it like lightly so it leaves a light spread, and then the smell was allowed to air dry. You just leave it open for it to air dry. So at the lab there's a lot of waiting. You just wait for a lot of things. So then the slide was stained with Gemstar stain for like 5 minutes, so that the cells inside can pick up stains depending on whatever cell it is. And then the slide was air dried and viewed under the microscope, like with the 100 times immersion. We use oil immersion for a clear picture, like so you'll be able to see clearly whatever you have been under the microscope. So I will show you a picture of what we got. Okay, so this is a picture of the slide. So you can see this here. This is a neutrophil. So most times you see the neutrophil. Okay. Okay, so you see this is a neutrophil and then the rest of the cells. So this is just basically what you see under the slide, and then you start to decipher whatever cell you see, whatever cell you are seeing. So that's all. Thank you for listening.
So thank you, Team Erudite. Right, you guys did well. So the next is to have their questions asked, and then you will answer. So if you have a question, please kindly raise your hand.
Good day. From your presentation, I see a lot of unacceptable things, sorry to say. You said amblyoma what? Americanum. Do you know why they named it Americanum?
Sorry, excuse me.
Yeah. Calm down. Do you know why it's named Americanum? Some ticks are named based on their location, where they can be found. So, calling amblyoma Americanum, I think we are in Garki, Nigeria. I'm not sure that's correct. And the tick, you said it was brought from the small clinic, so fortunately it was handled by us. We saw a brown dog tick, and that is not even amblyoma. That is Rhipicephalus sanguinus. Thank you.
Was it the tick of this morning? Yes.
No. Don't worry. The first tick.
Okay, as regarding to the first one, he said, actually, I wanted to correct that to it's amblyoma variegatum, not amblyoma americanum, because that's the most common one we can find around here.
Good afternoon. Good morning, sorry. My question is directed towards the person that took thin blood smear. I don't think that was thin blood smear you described to us, because you were talking about concentration, blood concentration, and I don't know when thin blood smear, maybe I'm outdated or obsolete, that where concentration is done in thin blood smear.
She's supposed to say the amount. She was actually telling you that the difference between thin and thick is the concentration, but it's the amount of blood that you use. That's what she was trying to say actually.
What if I was not in her mind, or what if I don't know about it? I'll be led astray.
My question is about the heart ticks. Is there a way we can differentiate the male from the female heart ticks? If yes, how?
Well, you can differentiate between the male and the female only when the female has sucked blood. It will be engorged. That's what I know. But then the female lay egg. Does the female lay egg? So they take more blood.
Okay, I don't know, but
Does the male not stop? I don't understand.
It does, but the female
Okay, you said the hard ticks have scutum. I think scutum is for the males, while the females have conscutum. That is two.
Yes, I was talking about the difference in general between hard and soft tick. I wasn't talking about hard tick male and female.
Thank you. Uh, Mubarak, it's like you are trying to tell us using a management for these hard ticks, using anti-helminthics. Yes. Okay, can you tell us some examples of these helminths that these ticks can be transmitted to certain animals or dogs? Yes. Some examples of helminth parasites, considering, yes, you say anti-helminthics, means that it transmit, it what? Transmitting the helminth. Yes, now.
From the, as you say, anti, that's you are against the parasite, the helmet bar. I'm talking about the drugs, where you can manage that tick so far.
So since with anti, you are targeting something. For what? To counter the effect of that.
The ticks, yes.
Which is the helmet. Okay. Can you tell us certain helmet?
That's why they give you an example that.
Sorry, can I take that?
Do you let's go. Let's be specific. If you are talking about anti-helminthics, it means that you are talking about agents that can counter effect the what, or can treat the helminth infestation. Okay. In the case of ticks infestation, you say that we can use anti-helminthics to treat them. I get him. Does that mean? Does that mean this anti-helminthic has effect on ticks or has effect on certain helminths that can be transmitted from the ticks to the animal during blood sucking? If there is, then can you tell us some examples of this helminth? Like 2 or 3. That's what I'm taking.
Okay, sorry, I understand where Aminu is coming from, and I just want to make it not as if it was actually an oversight of what he said, but I would like to give an example. There is this helminth. I don't know whether it's really a helminth or a parasite. Heterarchis gallinarum. I don't know if you've heard of it. It actually has. I'm not really sure whether it's a tick. It's not really, but I just want to. Okay, it was actually an oversight. Thank you.
Okay. You said levamisole, if you overdose it or underdose it, it can be fatal. Why?